A team from the Inspectorate of Government office, led by the Inspectorate General of Government, Lady Justice Naluze Aisha Batala, has made an impromptu visit to Mbarara Regional Referral Hospital. The team is currently on a tour of Western Uganda to find out gaps in service delivery that could be linked to negligence, corruption and abuse of office by civil servants. At Mbarara Hospital, the team found out a brand new ultrasound machine has been installed to serve its purpose. A new digital X-ray machine whose printer has expired films was also found in the referral health facility. Dozens of patients were found sleeping on the floor due to lack of beds and space.
Observed that some people are sleeping on the floor, others are right here in the tent, and yet they are patients. We also identified cases where some medical officers asked for money to feed these people, and that it is ranging from between 500 and 700,000. We have identified them, and we have chosen to give the names to the director of this hospital for an appropriate action. We found out that government delivered a brand new ultrasound machine which has never been deployed. That new ultrasound machine is kept in one of the rooms for a simple reason that there is no space to deploy it. We've talked to the director of this hospital, and he has accepted to at least improvise curtains so that we get to deploy that ultrasound machine.
Deus Tresije, the acting hospital director, said they lack space where to install a new ultrasound machine.
The new machine which is lacking space. You only have one with a very long queue of patients, and yet there is a brand new ultrasound machine which is not deployed.
Well, I agree with you. We have it, but we never got it in IGG. The available room, when they were providing this ultrasound scan, they thought we would use these rooms.
If we have patients, can't we install a bed and and also create some small space and the power source for this patient to operate?
That's very true. And I have to imagine that, sir, you must have interacted with these people. When we found we could not employ either, put a machine in those two rooms, and again we could not share.
He said the X-ray machine was taken to the facility by the health ministry when it was already faulty.
It is a demand the people want an X-ray. Our monitor that came with it cannot work. It came when it was faulty. The films that came, they are expired. They don't even print. When you take, they don't take anything. They don't come out. That's why we are fumbling now with our smartphones, so that at least we can provide service for those who are patient with us.
He said that as a hospital, they charge 200,000 shillings for CT scan services, a figure that was disputed by some patients.
This was the first regional referral hospital to get a CT scan, and that was in 2013 or 14. And by then I was not yet here. The communication by then was people should pay for a CT scan, and they pay maximum of 200.
Maximum of 200.
Mbarara Regional Referral Hospital has a capacity of 270 beds, but they have been forced to add more beds, making a total of 554 beds.
This hospital, its bed capacity is 270, but the physical beds are 554. We still had the meeting under the tent, we had the meeting on the veranda. Actually, it is good that this kind of team is here, maybe in the future, to add a voice on this. We are overwhelmed.
According to Tresije, the hospital serves 600 patients every day and between 500 to 570 patients every night, which stretches their budget.
Yes, what's it?